Week. Happy to be today at Ortho United, actually at the Oasis Surgery Center. And this is going to be another jam-packed day filled with a lot of great information for you. We have so many folks scheduled to talk. But first up, we're going to have a little chat with the COO of Ortho United, Fred Lickey. And I'm so glad to have you back with us. I just said to you before we came on the air, it just feels like just yesterday. It's been, it's very comfortable saying Ortho United, right?
It is, and it's become natural, and it's gone really quick. Thank you for having me today. And it's hard to believe that it's been a year and a half. January 1, 2023 was the effective date of the merger, and here we are a year and a half later and trying to get fully integrated, and we've come a long way.
Yeah, it feels like we've been doing this forever. So talk a little bit about that. I mean, how's it been going for you guys?
Well, it's been great. You had these two practices who are in this market competing with each other for 25 plus years, and a lot of competition, and now that everybody's working together, that's really disappeared, and we've been able to integrate the practices together, and just to see how the physicians have come together and respect each other and collaborate and work together with each other is just amazing. Maybe some people who had certain feelings about each other are sitting together at Country Fest last week, having a blast and wearing their cowboy hats and laughing with each other. So, it's been an amazing integration, culturally, at the physician level as well as the staff level.
Yeah, that's great. Now, what about at the patient level? How's that been?
It's been great. What we've realized over the last year and a half is, oh my gosh, we share a lot of common patients. One patient saw a previous spectrum physician for a foot and ankle, and they see an Omni physician for hand. And now we're getting away from the spectrum and Omni nomenclature, because now the market and people are recognizing Ortho United. We kind of kept those names and campuses just to retain that historical recognition, but now we're really fully going forward with the Ortho United name and really not trying to designate between the two.
Yeah. Now, for people maybe who are just, they're listening and they're saying, okay, I wasn't aware of what one was separate from the other before. Yeah, what kinds of things and services are you offering?
Well, a lot of things that we're doing, you asked about the patient perspective, we're really in a process now where we're kind of re-engineering the whole patient workflow and internal workflows. We've identified that there were some best practices that one group was doing compared to another group. So right now we're deep diving into every aspect of the patient experience and trying to identify what is the best scenario, what is the best workflow, what's the best experience for the patient, what types of things might have one group done versus the other, and really finding best practices and implementing that both internally and externally from the patient perspective.
Yeah, I remember you saying that it was important to, not double up on certain things, and you wanted to just make sure that you were offering as much as you could. And so do you feel like that's happened, that you've figured that out?
Well, it has, and the start to that, from internally and the patient's perspective is, it took about 8 months, but last August the Spectrum campus came onto the same electronic health record as the Omni campus. So now we have one unified patient record. So if a patient's seen at one office or a previous Spectrum physician, now they're seeing an Omni physician, we all have the same medical record and we can see what was done. Where in the past, when patients went from one campus to the other, you had to call and request the records, just like you're going to a different organization. Yeah. Now it's all the same organization, so we can see these patients' records and what was done at the other campus and really try to coordinate that care. So a lot of other things we're trying to standardize around the technology and vendors. I mean, that's what we've been doing over the last year and a half, is standardizing some of the technology packages and resources that we use, standardizing some of the vendors, and consolidating contracts and agreements, and kind of getting all that stuff aligned. It's taken a lot of time because we have so many vendors and so many different things. Not only from the vendor perspective, from the employee perspective, standardizing our benefits packages and our policies and procedures, and we've come a long way in that regard.
And where we are right now, we're at the Oasis Surgery Center. This is also something that's been a great asset for patients.
Yeah, both the Oasis Surgery Center and then there's the Ohio Specialty Surgical Suites, which is the other surgery center. The previous Spectrum Surgery Center was the Ohio Specialty Surgical Suites. Oasis was the one mainly owned by the Omni physicians. So now, with Ortho United, we have 2 surgery centers that we can offer to patients. And that's something we're trying to get the word out is, if you take a look at, where you receive care, do you go to a hospital? Do you go to an emergency room? Do you get right into an outpatient center? And that's really what we're trying to focus on is in our express care clinics. And I don't want to talk too much about those because some of the physicians coming up will talk about, our express walk-in clinics. But really, we try to have really quick access to high quality, lower cost orthopedic care and take care of patients right away when they need it. Many people who have an injury, you don't want to wait a week or 2 weeks. You want to get it taken care of now.
Yeah, or even like 14 hours.
Right. Mm-hmm.
Yeah. So, and I remember as the last time I talked to you, there was a transition for you too. I mean, just talk about your background and how that all worked out for you.
Yeah, my background was I worked for a public accounting firm. I'm a CPA. I ran a healthcare consulting practice at a regional firm, and Omni Orthopedics was one of my clients. And so as I was consulting with them on the merger, they eventually asked me to come join them and to be part of this great organization, which has been amazing. So I came in November, right before the merger, in November of 2022. So it's been an amazing experience, and just to work with, such, great people, both the staff and the physicians, and I have the utmost respect for all of them, and they're just wonderful to work for.
Yeah, that worked out perfect for you. And who better just than somebody that was there from the get-go, right?
Right. And I had managed other medical practices in the past in my career, so to kind of be here with this great group of physicians and such a large organization and progressive, it's been wonderful.
So any bumps in the road as you were, making this journey so far?
Oh, of course not.
Or any that you can talk about?
No major bumps in the road. No, really.
No.
It was,
you guys
a
did
lot
well.
easier than expected, I guess some of the hardest things were, maybe at the staff level or each organization had their own ways of doing things, right? And to try to figure out, okay, was it the Spectrum way the better way, the Omni way the better way? And as we integrated, the 2 groups under one electronic health record, it forced us to take a look at how things were done. And that's why we're continuing to evolve that process of standardizing how things are done from an internal and patient's perspective. But, no real major bumps in the road, that I can speak of.
Yeah, it seems that it has been integrated very well, so that's...
Yeah, it has. And then we continue to grow. We have a new physician starting July 1st, Dr. Michael Barnett. He's a foot and ankle surgeon. We have identified that's one of the needs in the group, and that's subspecialty. Most of our physicians are very subspecialty fellowship trained in a particular body part, and that was an area that we identified a need, and he's agreed to join us and move back to the area. He did his training at Akron General, went off into hospital employed situation, and realized he wanted to come back and be part of this entrepreneurial spirit that this private practice can offer. We have a couple other contracts out pending for new recruits, so we try to always look at what are the needs and what are the subspecialty needs, try to foresee those physicians who may be retiring and replace them so that we continue to grow.
Well, we have a lot to talk about today, a lot to get to, doctors to visit with, and I know we're going to get to you again as well. So I'm glad that we had a chance to start off with you so we can kind of set the stage for all of the discussion we're going to have today. Fred Lickey, thank you so much for sitting down with us this morning.
Thank you for having me.
All right, we're going to take our first break, and when we come back, we are at Ortho United. I will talk with Dr. Brett Daly, sports medicine. Time to discuss that, the walk-in clinics here, and also overuse injuries in youth sports. I know that is a thing for sure, and we'll discuss that as our Healthcare Week continues at Ortho United. We are broadcasting live from the Oasis Surgery Center on 1480 WHBC.
This is the story of the one. As a maintenance engineer, he hears things differently. To the untrained ear, everything on his shop floor might sound fine, but he can hear gears grinding or a belt slipping. So he steps in to fix the problem at hand before it gets out of hand. And he knows Granger's got the right product he needs to get the job done, which is music to his ears. Call, click Granger.com, or just stop by. Granger, for the ones who get it done.
Pizza's here.
Oh, great. I'd love some, but I'm worried about my stomach issues.
If you're worried about having diarrhea, bloating, stomach pain, or loose oily stools, it may not just be stomach issues. It could be a condition called exocrine pancreatic insufficiency, or EPI. With EPI, the pancreas doesn't release enough enzymes to break down food, but EPI is manageable. Use the symptom checker on identifyepi.com. Talk to your doctor. That's identifyepi.com. Sponsored by AbbVie.
Wesley Financial Group is not a law firm. An important message about your timeshare from Chuck McDowell, founder of Wesley Financial Group.
If you receive an unsolicited phone call or mail piece to discuss selling, renting, or especially canceling your timeshare, don't fall for it. Contact your timeshare resort or Wesley Financial Group for assistance, and I'll send you our timeshare exit information kit free with the straight facts about timeshare cancellation.
Call 800-653-1188. 800-653-1188.
At Ortho United, orthopedic care is more than medicine. It's a commitment we make to provide accessible, world-class orthopedic solutions to our community. The partnership formed by Spectrum and Omni Orthopedics makes Ortho United the largest orthopedic provider in Stark County, with more than 35 doctors to serve you. The skilled orthopedic experts at Ortho United offer the latest advancements in cutting-edge technology and care. Local providers, helping each and every patient take their first steps toward orthopedic health. Let's get better together. Learn more at orthounitedohio.com.
On the battlefield, there's a saying America's military men and women live by. Never leave a fallen warrior behind, ever. Off the battlefield, Wounded Warrior Project operates with the same goal. Wounded Warrior Project was created to help our men and women returning home with the scars of war, whether those scars are physical or mental. Wounded Warrior Project. We never leave a fallen warrior behind, ever. Learn more about what we do at woundedwarriorproject.org.
Progressive presents 10 things on a food truck owner's to-do list that are harder than getting a commercial auto insurance quote. Stocking the fridge, prepping the stations, finding employees that get along well, finding employees that actually do their job. Looking at you, Gary. Balancing the books, balancing the flavors, having a fresh menu and fresh produce and fresh meat, but never a fresh mouth. But the easiest thing on a small business owner's to-do list? Seeing if you can save on commercial auto insurance. Get a quote in as little as 7 minutes at progressivecommercial.com. Progressive Casualty Insurance Company and Affiliates. Coverage subject to policy terms and conditions.
At Fisher Investments, we may seem like other money managers, but we're different.
Are you really that different than the rest of us?
We are. As a fiduciary, we always focus on what's best for our clients.
What services do you offer besides investing?
We have a team of specialists in financial planning, estate planning, and more.
Your clients rely on you for all that?
Yes, we ensure clients receive unparalleled service at every step of the relationship.
Okay, but you still sell commission-based products, right?
No, because we believe that's a conflict of interest. We prioritize service over sales goals.
So, then how do your fees work?
We have a simple and transparent fee that's a percentage of our... So we do better when our clients do better.
Wow, we're more different than I thought.
At Fisher Investments, we're clearly different. Learn more at fisherinvestments.com.
Investing in securities involves the risk of loss.
The IRS is the most powerful collection agency on earth. And if you owe back taxes, the news isn't good. The IRS has raised the interest rate it charges on unpaid taxes in recent years. This hits hard if you're behind on your taxes. Most people don't know it, but the IRS adds interest charges to your tax debts daily. If you owe the IRS today, you'll owe even more tomorrow. And it doesn't stop until you get right with the IRS. The good news is getting right can start with one phone call to Optima Tax Relief, America's #1 tax tax relief firm. Optima's tax professionals specialize in the Fresh Start Initiative, a powerful IRS program that can save you thousands if you qualify. A-plus rated by the Better Business Bureau, the experts at Optima have resolved over $1 billion in tax debt for their clients. Call now for a free consultation.
Call 800-343-6460. 800-343-6460. 800-343-6460.
Optima Tax Relief.
Some restrictions apply. For complete details, please visit OptimaTaxRelief.com.
All right, good morning, everyone. Welcome back to our Healthcare Week. We are right now broadcasting live with our friends from Ortho United. We are at the Oasis Surgery Center. I just have to tell you a little story about it because I forgot to bring it up with Fred. Fred and I were talking about it off the air. My mom has had surgery here a couple of times, and she always would talk about how she loved the drive-through that they have. And it's not a drive-through like a food drive-through. It's when you pick the patient up. You actually drive through inside, and they bring the patient to your car. So if it's raining or snowing or anything like that, it's very simple, and they can bring you in. And she just always said, oh, yeah, that's the place with the drive-through. So pretty cool. It's actually a pretty cool thing. So I laugh every time. I told her last night, yeah, I'm going to the Oasis Surgery Center. Oh, the place with the drive-through. Okay, very good. All right, we are going to continue our discussion, and we have with us Dr. Brett Daly, sports medicine. Good morning, sir. How are you?
I'm doing well. Thanks for having me.
I'm going to have you lean in just a little bit, yeah. So first of all, before we get started on some of the things we want to talk to you about, give us a little bit of your background.
Yeah, so my background is I'm from Northeast Ohio. I'm originally from Elyria. My wife's family was from Canton, and that brought us this way. And I found at the time Omni Orthopedics, which was a great practice for me to join. It was a perfect fit at the time, and it's just grown from there. I did my undergrad at Ohio State, where I actually played football there. I was a walk-on defensive end and stayed there for 4 years. Had some great times there. Stayed there and did my medical school training as well. And then I went on and trained up at SUNY Upstate in Syracuse, New York, where I did orthopedic training, and finished it off at Wake Forest, where I did a specialization and a fellowship in sports medicine.
All right. So, and you're like, well, how tall are you?
6'7".
6'7". We talked about this before, I know, because I asked you if you played basketball, but you played football. 6'7". See?
Yeah. I've lost about 50 pounds. So most people assume basketball now, but I was quite a bit bigger then. So.
Yeah. Wow. Yes. So you were a good defensive end, I'm sure, obviously. All right. We're going to talk a little bit about, first of all, let's talk about the walk-in clinic and how important that is. Because, boy, people, especially with, if you break your arm or something happens and, you want to be treated quickly and, you don't want to all the time run into the hospital emergency room.
Yeah, so we started this walk-in clinic several years ago. Most places will have them. You'll have these express clinic or urgent cares all over the place. The nice thing about ours, which we have one on both campuses, whether you go to the Omni campus or the Spectrum campus, there's walk-in clinics there. You should be able to you can be seen same day. But it's specializing in orthopedic medicine. So you go to these other places, whether it's an urgent care or an emergency room, and you'll get treatment. But it's going to be general treatment. They get an x-ray, they say, well, nothing's broken. Nothing's broken, go follow up with orthopedics. They're going to tell you to come see us or go see someone else. But they kind of just rule out that it's anything terrible. And they might give you a brace, they might give you some crutches. Sometimes it's not the right brace. The nice thing coming to our facilities is you get in, you get seen, I think, pretty quickly. I think we get you through the doors and seen and out there much quicker than an emergency department. You get more specialized care. It's usually our mid-level providers which are seeing you that day, but there's doctors available and on staff, and they're bouncing things off us. And they've been trained by us, so they try to treat you the same way that we would. You might not get your definitive care at that time, or they're not going to be ordering MRIs or maybe giving injections, but they can give you a more focused plan and tell you, this is the injury you have, and get you not only to orthopedics, but try to get you to the right provider and doctor as well. And then we can see in the chart everything that was done. You already have your x-rays, and it just moves the process along much quicker.
And is it open at certain hours of the day?
Yep, so we're open, it starts at 7 a.m. in the morning, and it runs till about 8 p.m. at night. That's Monday through Friday. And then on Saturdays, we're open, I believe, from 7 a.m. until noon. So
and that's good for football players, right?
Yeah, I mean, it's great for the sports injuries. And, that's my specialty, and that's what I love to treat. But all these kids, whether it's, football practice will be starting up or it's track, you pull a muscle, you roll an ankle, something happens. And sometimes you just want to know, did I break it? Did anything, I felt a pop. And it's very easy to come in and get that x-ray and get that treatment that night and that day. And you don't have to worry about going to the ER and battling with, the other people that are there with maybe some more pressing issues, heart conditions, different things. And when they triage you, they say, okay, well, this is an ankle injury. You're not that urgent. You're going to sit in the waiting room for 4 hours until we get all these other emergent things out of the way. But with us, we're all treating you, we don't have to triage you that way. It's first come, first serve, and we try to move you through pretty quickly.
Yeah, I've done that. 2 boys, both played every sport, and, I have done that on a Saturday night at 11 o'clock. Yeah, so, and that makes it a wonderful thing. Are they at both locations? Or?
Yes.
Okay.
Yep, it's provided at both locations. Hours are a little bit different between the two, but yeah, you should be able to come in and be seen pretty quickly at either campus.
And I don't want to confuse people. It's not just for sports injuries. I mean, this is if, grandma slips and falls or something like that, right?
Absolutely. Anything orthopedic, so that's the thing is if you're sitting there and, you fall, your wrist hurts, your elbow hurts, anything like that you're worried is an orthopedic problem. Back pain, numbness shooting down into your foot, any of those problems you can come in and be seen and you'll get the, more appropriate care. It might be a prescription for an anti-inflammatory or a muscle relaxer or a brace if you need that. Like I said, it's not always getting you right to the definitive care, but at least gets things started in the right direction and a more kind of specialized treatment plan rather than just the generic one you would get at like an urgent care that's treating all conditions. But yeah, this is for all ages. Sometimes there are some cutoffs as far as, if it's extremely young children with certain issues, those are sometimes better suited to go up to Akron Children's, but for the most part, we're seeing people from young kids all the way up to grandma and grandpa.
Yeah, it kind of gets you started on the path, like you said, because I do remember going to an emergency room where, like you say, they refer you to an orthopedic place, and you have to make that appointment, and then it delays everything for a long time.
Not only that, but sometimes when you get started at those places, if they are not comfortable with, their orthopedic exam or what they're looking at, they might get an x-ray and just say, this is not broken, I'm not sure what it is. They might slap a brace on you and give you crutches and send you out, but then when you show up to us, if that's the wrong brace, like maybe you needed a different one, we run into insurance issues sometimes there where insurance only wants to pay for one brace, and then we're like, well, this is the one you really need, and it just, streamlines things and tries to make sure that you're getting the appropriate treatment from the first step.
Okay. Well, we're going to take our break for the news right now, and when we come back, we're going to talk with you about overuse injuries. Kids in sports, and some more things like that. We will do that as we continue on our 8th annual Healthcare Week. We are broadcasting live from the Oasis Surgery Center. Of course, this is Ortho United on News Talk 1480 WHBC.
The Plain Township Amphitheater presents the Motown Sounds of Touch, Thursday, June 20th at 7 p.m., featuring a full band and all the major hits from the Motown era. Tickets on sale now at plaintownship.amphitheater.com.
Wax on, wax off. Dad, I'm tired of it. Can I just call Auto Tech Ohio so I never have to wax your car again?
Never wax my car again?
Yes, they have a Shine Plus system that will keep your car looking showroom new, and I won't be spending my time waxing your car.
Are they professionals?
Yeah, it's the same place that window tinted my car. For 40 years, they have been in the auto detailing business.
Wow, stop waxing my car.
Visit autotekohio.com or call 330-837-8820.
With T-Mobile, you can get tons of benefits and still save, because nobody likes having to choose. It's like getting romance and sci-fi.
I love you. Also, I'm a robot.
At T-Mobile, you can get the benefits you want and still save on every AT&T and Verizon. See how with our savings cap.
There, providing hot meals, a safe place to sleep, medical care, and love.
To
To learn more, go to safeplacetosleep.org today.
Spring cleaning starts with clean water. Call Verndale Water Experts and schedule their $49 software checkup and sanitation service. Get pure perfection with Verndale Water Experts.
Tap into Verndale's Water Center.
WHBC AM Canton, reliable as ever on News Talk 1480 WHBC.
From the WHBC newsroom, YouTube is testing out a system that allows viewers to fact-check videos with community notes. The notes can be used to provide context, additional information, or clarification, such as whether a video is a parody or contains outdated footage. The system will be tested with a limited number of contributors. Similar systems have been put to use on X and also on Google. A popular chain in Cleveland and Columbus filing for Chapter 11 bankruptcy. The Melt Bar and Grill has been struggling after lawsuits claim the business had not been paying rent at several locations. Melt has a reported financial loss of just under $5 million. By filing Chapter 11, the company could stay in business by restructuring. There's no word on if that will happen. The Melt has locations in Lakewood, Akron, Mentor, and Columbus. National Hurricane Center officially designated a disturbance in the Gulf of Mexico as potential Tropical Cyclone 1 last night. That disturbance was around 360 miles southeast of La Pesca, Mexico, as of 2 a.m. If it strengthens to a tropical storm, it'll claim the name Alberto as the first named storm of the season. The Cleveland Guardians had the night off last night. They open a series at home tonight against the Seattle Mariners. First pitch will be 7:10 on 1480 WHBC. Boston Celtics are the NBA champs for the 18th time, the most championships in NBA history. Florida Panthers could win the Cup tonight. The quest for the Stanley Cup moves back to Florida. They have home ice advantage and a 3-1 series lead over the Edmonton Oilers. And also in hockey, Columbus Blue Jackets making a move in the offseason. They have fired their head coach. For News Talk 1480 WHBC, I'm Pam Cook.
Your severe weather station, News Talk 1480 WHBC.
Here's the AccuWeather forecast this afternoon. Partly sunny with a few widely separated thunderstorms. The high 93. Tonight, cloudy and humid, low 72. Partly sunny, hot, and humid for tomorrow. A thunderstorm in spots in the afternoon hours. High Wednesday, 91. Thursday, hot with a high 95. And on Friday, a thunderstorm in the afternoon. Partly sunny, hot, and humid. High 93. I'm Andy Robb for News Talk 1480 WHBC.
It's Kenny and JT.
From the class of 2003, James Lofton joining us right now.
I still have 2 plaques from when I played for the Packers. I won the long throw contest. Back-to-back years, 88 and 83 yards.
In the air?
Yes. Now, we had a running start. What do you mean in the air? No, on the ground. It hit, and it rolled.
Well, it did like a drive.
This is not a putt.
This may not be a Vegas residency, but we appreciate you joining us here in Canton, Ohio, because we appreciate it more than Good Morning America or Las Vegas.
I love it. Yeah, I'll take Kenny and JT any day over Las Vegas.
There we go.
This is Pro Football Hall of Famer James Lofton, the Kenny and JT Show on News Talk 1480 WHBC.
Browns, Buckeyes, Cavaliers, and high school sports. We know this is a sports town. 1480 WHBC has it all.
Sports. I'm a huge fan. I played in college. That's what I'm tuned into right now, sports.
Your home for the NFL, NBA, MLB, college football, and high school sports. If it's sports you're looking for, this is the right place. News Talk 1480 WHBC.
Radio works because it is a friend, a colleague, company. It is important to my local community. It is a facilitator. It is a driver. You know, as human beings, we all have many characteristics, many things that we all rely upon in order to be able to live each day. Radio has all of those wonderful characteristics, and radio does that better than almost any medium I can think of.
Thank you for listening to WHBC and letting us be a part of your day. Welcome back. This is the 2024 Healthcare Week, our 8th annual, believe it or not, and we are broadcasting with our friends from Ortho United. We're at the Oasis Surgery Center, which is basically at the corner of Whipple and Portage. And if you haven't seen it, it's a beautiful place. Honestly, if you have a chance to, you have a need to come here, then do it, because it's a great place and you'll feel very, very comfortable. And you just heard, the radio station is the place for sports. Well, this is the place for sports medicine. And we have Dr. Brett Daly with us, who specializes in that. And we were talking about the walk-in clinics, and that's an important part of helping people. But we also want to talk about youth sports. Well, first of all, you played football for Ohio State. We were just talking about that off the air. You know how it all goes. And now it's escalating for parents. It's escalating for kids. They're trying to specialize in one sport, saying, "Yep, I'm gonna be that football player. I'm gonna be that baseball player." But that's causing some problems for kids, isn't it?
Yeah, it really is. Anymore, the sports, no matter what sport it is, whether it's baseball or volleyball or softball or basketball, they've all become a year-round event. Back when I was playing sports in high school or little league, you had seasons. You had baseball was spring and summer, and then you went into football season, and you had basketball season. Everything was kind of broken up. There would be occasional, if you were elite at your sport, you would play AAU basketball, or maybe you play hot stove baseball. But those travel teams were kind of few and far between, and they were usually only for a select few kids from like the towns. Anymore, it seems like there's no little league sports anymore.
Yeah.
Everything has turned into this year-round event with travel teams, and it's just nonstop. And what that's leading to is a lot of injuries that I see in my office that just are probably unnecessary. And it's because the kids, they don't get a break, and sometimes if you're doing the same sport over and over, it's just too much wear and tear on the same body parts. And that could be anything from running or jumping, or in the throwing sports like baseball and softball, I see a lot of the arm injuries now.
How can you tell? I mean, what kinds of things happen?
I think I could tell just because it's young kids at critical ages of development that are, having issues with their growth plates. There's classic injury called like little leaguer shoulder and little leaguer's elbow, where you have growth plates in your shoulder and your elbow that are prone to injury. And if you're throwing too much or you don't get that break, it starts to affect those growth plates, and then you get stress fractures and different injuries. And we see those a lot. Baseball, I think, is probably one of the biggest culprits. It's turned into a sport where they go from their spring season with their school to summer ball with their travel team to fall ball with a different travel team, and then in the winter they got a pitching coach and a hitting coach, and it never ends. And then they ramp up with their pitching coach, and then by the time spring comes around, they're coming into my office because they're trying to throw hard to get on the mound, and their elbow hurts. And it's really just too much demand on one part. I'm a big proponent of multiple sports. I think that's something that's gotten out of hand, is that I think if you want to excel at sports, you need to focus on being, first and foremost, just a good athlete, and that comes down to just hard work, becoming fast, becoming strong, and becoming coordinated, and you develop that through all sports. You'll notice that a lot of these professional athletes that you'll see, they do excel at multiple sports. You watch Myles Garrett, but the guy's a freak athlete on the football field, and he's a freak in general, so you can't compare everyone to him. But then you watch him go on a basketball court, and he's just an athlete.
Mm-hmm.
But those are the things, like being athletic and strong really leads to you, excelling at all sports.
Yeah, like Patrick Mahomes. He could be a baseball player if he wanted, professional baseball player if he wanted to.
Yeah, and Kyler Murray, a lot of those professional quarterbacks are very skilled. Another thing that's unique in this era now is the training that these kids get. I've been watching a lot of high school sports and basketball games and football games and even baseball games, and it's kind of I look at these kids on the fields now, and they look like grown men. The training that they're getting these days is a lot more intense than what we got. When they go out there, they got, one thing, their uniforms look like professional uniforms, but then just the development they are, how muscular they're very developed, and that's great. But that puts a lot more stress on the body. It just shows how much more intense the sports are these days. There's a lot of facilities around here that provide personal training to either athletes or the teams as athletes, and that's good. I just think a variety is important, and I think it can help you be available for the field. There's a good saying that says, no matter what sport it is, your best ability is your availability. If you're injured and you can't play, you're no good to yourself, you're no good to the team. So if I was going to stress anything, I'd just say that as parents look at this, I know they're trying to do what's best for their kids. I know they want to get all the training for them. They all want their kids to do as well as they can, earn college scholarships, go as far as they can, and pursue their passions. But at some point, you have to step in and say, we need a break, and it's not going to hurt them. I've been there. I went up to Ohio State, and I've played at very high levels. And I'll tell you, with a lot of my teammates, they will stress the same thing, that they believe it's gotten out of hand as people are trying to pursue, these high levels of athletics, that they are almost causing more harm because they're doing too much at too early of at too young of an age.
So physically, what kinds of things do you suggest the kids do?
I think, just physical training is good. Lifting and just general training to become faster and stronger is good. But I think the most important thing is play different sports. I think the biggest culprit I see with kids coming to my office, whether it's knee injuries or elbow injuries or shoulder injuries, it's that they are playing sports that are very hard on those joints. Like, these young girls will be a volleyball player year-round. Maybe they'll do volleyball and basketball, but it's still the same thing, where it's just repetitive jumping, and it's really hard on their knees. The baseball players, it's one arm. You're putting a lot of stress on one arm year-round. You're not using other extremities. So I think changing it up, play football, play wrestling, do something different to try to just engage the rest of your body. And I think in the long run, the strengths and skills you learn in other sports will translate to make you a better athlete overall.
Will these things have an effect on them as they get older, or for the rest of their lives, that kind of thing?
Usually not so much for the rest of their lives. What it does is I see, athletes that want to have these great careers, and sometimes those careers are ended before they can even, get off the ground.
Yeah.
It's one of those things where you're pushing so hard at an early age that you almost, stop their development before they can even get going, or they don't have the chance to excel because they've had a shoulder that they, had to have a surgery on when they're 15 years old.
Yeah. What about the weekend warrior? I mean, is this, I'm just going to ask you that one, because, there's all these people watching us right now in this conference room that probably are wondering, should...
The weekend warrior is great for business. No,
I love that.
Pickleball's been fantastic for business. No, the weekend warriors are great, and I see a lot of those. I'm sports medicine. I love to treat athletes, but I love to treat athletes of all ages, all activity levels, and one of my main goals is I want to keep people active. I am not the doctor where you come to and I'm going to say, listen, you can't run anymore, you can't play pickleball, you can't, go to the gym and try to, play pickup games at the YMCA. I want you to be athletic. My goal is to try to find ways to keep that going. And I think for the weekend warriors, it's, first and foremost, stretch and warm up. As you get older, that's an important thing. I see pickleball has been a very popular sport, and I joke that it's been great for business, but the problem is people look at it and see it's a low-demand sport, and people love it. But they get out there, and you have people that haven't exercised or done anything. They're like, yeah, I'm going to go play pickleball with my friends. And next thing you know, they tear a meniscus, they tear an Achilles, a lot of injuries. It's just, keep yourself active, whether that's just walking, or running, or going. We have great YMCA facilities around here. Like, get out and just do a little exercise. But it's, I want to keep you going. I think the weekend warriors, I think they're fantastic, and we want to do everything we can to keep them out there and being as active as they can be.
Do you see, and back to the kids and the young athletes, do you see any one particular injury more often than others? I know you were talking about softball players and the arms and things like that.
It's seasonal, so like I said, like right now we're in the early stages of summer, so that's the first thing that comes to mind, because early in the spring and then right now I see a lot of those baseball and softball injuries because those are the seasons that we're in. So I'd say it goes through phases. As we get into the fall, that's going to be soccer and football, and that's when you see a lot more like the knee injuries. It does seem like anymore there are more and more ACL injuries at young ages, and I think a lot of people look into that and try to figure, is it because of these AstroTurf fields or this or that? I don't think there's a clear answer. I don't know if the AstroTurf fields are the culprit. One thing I alluded to earlier is as you look at these professional athletes and the injuries they have, and even these young kids, I think it's how big and fast and strong they're getting. You're putting a lot of force through these joints, and so I think that's one of these things that kind of increases your risk of having those injuries. It's just you're putting some pretty impressive loads as you have these kids out there that are squatting 400 pounds in high school, and I just think that at a young age it's a lot. But to answer your question, I'd say that there's not one specific injury that I think is like the most common. There's a variety, and it comes through waves based on the season.
And you're seeing these bigger, stronger, faster kids come at your child, so
yeah.
that's a hard one too. All right, we'll take our break, our final break for this hour, and when we come back, we want to talk about getting these kids back on the field.
Absolutely.
Are they going too soon? Is there a way to get them back on in an efficient manner that's safe? And we will do all of that as we continue with our Healthcare Week. Ortho United at the Oasis Surgery Center right here on 1480 WHBC.
operates with the same goal. Wounded Warrior Project was created returning home with the scars of war, whether those scars are physical or mental. Wounded Warrior Project. We never leave a fallen warrior behind. Ever. Learn more about what we do at woundedwarriorproject.org.
Progressive presents 10 things on a food truck owner's to-do list that are harder than getting a commercial auto insurance quote. Stocking the fridge, prepping the stations, finding employees that get along well, finding employees that actually do their job. Looking at you, Gary. Balancing the books, balancing the flavors, having a fresh menu and fresh produce and fresh meat, but never a fresh mouth. But the easiest thing on a small business owner's to-do list? Seeing if you can save on commercial auto insurance. Get a quote in as little as 7 minutes at progressivecommercial.com. Progressive Casualty Insurance Company and Affiliates. Coverage subject to policy terms and conditions.
WHBC. We are with our friends at Ortho United, and I have with me Dr. Brett Daly. We've been talking sports medicine. We've been talking about the importance of variety, but now let's talk about efficiency of care, because you know every young man or young lady who gets hurt, they want to be back on the field as soon as possible. So how do you make that happen for them?
Well, that's one thing that we're really proud of at Ortho United, and one thing that I think that we can offer the community that's superior than going to some of the other facilities is that we get you in very quickly. You know, a lot of times if you call in, you're going to be able to be seen that day at our walk-in clinic. You might be able to get appointments that day with a physician. You're not going to have to wait more than 2 days, 2 to 3 days most of the time to get on with one of our providers. We have a lot of sports medicine providers. We have a lot of other specialty providers, so we can get you in very quick. The next thing is moving the process along. You know, when you're an athlete, the people that I like to treat, these high school athletes, if you're in season and you have an injury, you don't want to miss time. You want to know what's going on, and you have to figure out how to treat it and can you play. Like I stated earlier, my background in sports makes me, I think, understand that desire a little bit more. I think there's a difference between sometimes are you hurt or are you injured? You know, hurt, everybody gets hurt during these sports. Injured means you can't play and you got to stay on the field. And we have to distinguish that and figure out, you know, what level are you? Can you play? Do you need to sit out for how long? And one of the things we do really well at Ortho United is we have MRI machines at both facilities, both the Omni campus and Spectrum campus. And we're typically able to put that order in, work it through your insurance, and get that done in about a week's time. You know, if it's a certain situation, sometimes we can try to push it through stat and get it done even sooner. But when I see these athletes and they have a game coming up, you know, we have to know how to treat them and get them back ready to play soon. And I think that's something that we make happen. You know, within 1 or 2 weeks, you can have all your answers. And sometimes I've had people, you know, come in with a knee injury, and within a week they've had their MRI, they've had their surgery, they've had everything done, and they're already starting their recovery.
And that makes them very happy, I would imagine, right?
Yeah, we try to give them, you know, top-class care, just like if they were a collegiate athlete or a professional athlete. You want to treat them the same way. I know these are, you know, amateur sports and high school sports, and it's not the, you know, the end-all be-all. It's not the end of the world, but to these young kids, it is. You know, these are the things that are most important to them in their life right now. So we want to, it's special to them when we want to treat it like it's special to them and try to make them miss as little time as possible.
Two people coming in, you know, as my mom calls it, Dr. Google, where they say, well, this is my injury, and I should be able to do this at this time, and
yeah, you get that. I mean, that's something that's been going on for a long time. I think, you know, it can be a little frustrating sometimes because, you know, that little bit of information that people get, sometimes they can go down a rabbit hole and they can come in with a lot of fears and concerns, and it's our job as providers to educate them and tell them, you know, that's what we train for, so that we tell them, you know, what the MRI means. You know, they can get the report for the MRI and they can see that maybe they have a certain type of meniscus tear. Well, not every tear needs to have surgery, but they might see that, they might Google it and say, oh my gosh, I have to have a repair, I'm going to have a 4 to 6 month recovery, I'm going to need crutches and brace and this and that. And then they come into the office and I say, you know, let's give you some anti-inflammatories, let it rest for 2 weeks and see how it goes.
good to go, yeah. Very good. All right, well, one last piece of advice for parents and athletes, what would you say?
I think parents, athletes, I think all patients in general is an orthopedic practice, I would say, just don't be afraid to make an appointment. I think a lot of people have to go out and do the yard work. We just want to help you live your life, be pain-free, and do well. So I'd say come in and see us. It might just be a conversation. It might just be some advice. It's not always shots and surgery, no
Thank you so much.
No problem. Thank you.
Great job. All right, we will be back after the news at 11 o'clock, and Dr. Ira Richterman will join us, hand and wrist surgeon. And you don't want to miss it. He always has a lot of good advice for everyone. And again, this is Health Week on 1480 WHBC.
WHBC AM Canton, trusted, reliable, and part of the community. Brought to you by Friends and Family Credit Union, providing financial needs to all of Stark County. It's time to bring a friend into the family on News Talk 1480 WHBC.
There are a lot of things to watch out for today. That story and more in seconds. Good morning. I'm Pam Cook with 1480 WHBC News. AccuWeather tells us we will have